This is a great opportunity for me and introduce to you our Department of Surgery Surgical Simulation Program. Okay, DSSSP is comprised of these four wonderful education units within the department. You can see the Ray George Surgical Medical Research Institute. It is certainly a cornerstone of our surgical education facility. The wet lab at our SMRI provide a very important training space for surgical residents. The equally important education unit within the department is certainly the anatomy. For hundreds of years, a surgeon spending hours to practice their surgical skill in the anatomy lab. This is not different here in our institute. Dedicated education staff in anatomy understand the needs of the surgeon, run many training courses for surgical residents at a different level. They help surgeons to get familiar of human anatomy and practice required skills before they can operate on the patients in the operating room. CASES stand for Centers for Advancement of Surgical Education and Simulation. It's a wonderful skill training lab located at Royal Alex Hospital. Dr. Dan Burge lead a wonderful education team who is working devotedly to training advanced surgical skills for minimally invasive surgery and robotic surgery. The Surgical Simulation Research Lab is relatively young. We established in 2011 with the funding support from the Faculty of Medicine and Dentist, and as well as from AHS. We study surgeon instead of the patient. We study surgeon instead of focusing on different kinds of diseases. We make great effort to understand surgeons' performance, and we try to understand how well they make a decision in the operating room. You can see all these four units are combining together. We have a shared vision, which is to dedicate to improve the patient care by training healthcare professionals in a harm-free but effective learning environment to maximize skill acquisition and transferability to the clinical service of our trainee using a state-of-the-art equipment and a cutting-edge innovation and research. Then this is our great vision. Our work will be supervised by our department chair and will certainly evaluate periodically by the physician, educator, and scientist in the dean's office. And you can see Dr. David Williams is head of our department, and three great leaders, Dr. Gina Reyes and Dr. Dan Levy and Dr. Dan Burge are the key leader for different units, and also it's the co-founder of the DSSSP. We will work with the program director within the department to design simulation to support your ongoing education activities. The idea combined task force from four education units into a joint program was developed in the years of 2018. After many hours in meeting, we complete all the visionary work and submit our required document to Loyola College in early 2019. The site visit and evaluation work was completed in the summer of 2019. In November 7 of 2019, the Loyola College approved the DSSSP as an accredited simulation program. The first 3 years phases was started on January 01 of 2020. Looking back of 2021, scientists and educators in DSSSP developed new simulation model for a new education curriculum for training surgical skills. Basic surgical skill workshops such as suture station, aseptic technique, and advanced training courses such as minimally invasive surgery for the trauma care and for microsurgery workstation was provided even under the COVID pandemic. Beside these skill training stations, we also organize several seminar and education rounds within the Department of Surgery. We share our research idea and then discuss our research findings. A surgery had a surgical education program, which is one of the kind education program nationwide. And 5 young talent surgeons has gained this prestigious degree in the past few years. Currently, we are training 6 graduate students in the area of surgical simulation. Each year, international visitors and postdoc fellows and healthcare educators are coming from the world to visit our simulation facility. And we are building research collaboration worldwide. In 2021, we have published 16 peer-reviewed papers, and we have more posters and abstracts for conference presentation. I understand Department of Surgery is currently in the process of developing strategic plan for the next 5 years. I believe maintaining excellency in education, research, and clinical care will be the central focus in the new strategic plan. We will continue to support education efforts within the departments. And to achieve this goal, I would certainly like to understand the needs of our trainee. I would certainly like to regularly talking to the program director, and we're trying to understand your current training curriculum. And then we hope we can design new simulation model to supporting your education. And if you already have a training curriculum, our scientists and graduate students will be happy to supporting you in the data collection and data analysis when you do the course evaluation. And if you have the intention to get some resident into the CIP program, and then we can hand in hand together to train more HQP in the area of surgical education. And certainly we like to supporting you research and then your education effort by working together, maybe in the funding application from either local funding organization or national funding organization.